firstly, as is our custom, I'd like to acknowledge the Indigenous people, both past and present, and thank them for allowing us to have this event this evening. It is my great pleasure to announce that CURF will have a new theme from this year about health and wellbeing, led by Professor Tony Capon. So thank you, Tony. And as we basically don't have any money, it's both Will Stafford and Tony Capon are really just wonderful in supporting this initiative. So I want to thank both of them for that contribution. Having said that, there was a political commitment last year for $1 million to come to CURF, hopefully honoured through the budget process this year. And to that effect, we met with both the Minister for Planning and Environment and many other things, Attorney General and Emergency Management, Simon Cordell last week, and also the Chief Minister. And so I'm feeling very positive about that outcome. So things are looking good. So our inaugural speaker for our new health and wellbeing theme is Dr. Carlos Dora from the World Health Organization. And it's a great pleasure to have you here. And we had a very interesting round table internally at lunchtime. Lots of interdisciplinary discussions. And a huge agenda there on its own, I think. So tonight's title is Health in a Green Economy, but I won't go into the details because Tony Capon, it's your role now as head of this theme to do that. So welcome, Tony.
Thanks very much, Barbara. Thanks very much, Barbara. It's terrific to be here this afternoon, and for us all here at the University of Canberra and at ANU, it's a great pleasure to welcome Carlos Dora to Canberra. I think his first visit here, a visit to another planned city. Carlos, being Brazilian, is familiar with the history and trajectory of Brasilia, which shares some challenges with Canberra at this time in Canberra's development. And Carlos's talk tonight on health in the green economy, he'll give this talk in the context of Canberra's resilient urban future. So he won't necessarily make a lot of specific reference to Canberra, but he'll be referring to the sorts of challenges we face here. Challenges like a transport system that's at the moment highly car dependent. How might we transition that to be a much more sustainable and indeed healthier transport system? People walking, cycling, using the buses, which in some parts of Canberra are actually very effective. Not in all parts, but it's a spread out city. So how do we transition this city to a more resilient future? And this is the first in a series of CURF seminars this year in honour of the Centenary of the Bush capital as well. So a few words about Carlos. Carlos is a public health physician, a similar background to me. He is currently working with the World Health Organization, leading their global work on healthy environments. He has a strong interest in the nexus between transport, environment and health, and he's worked both as an academic, a medical practitioner, a policymaker, and now in the last decade or so, I said earlier today, since last century, he's been working with the World Health Organization. So let's welcome Carlos and enjoy his reflections.
Thank you, Barbara. Thank you, Tony. Well, great pleasure to be here. We have already, I can see the strength of the Australian people because we got in straight into business. It was very entertaining and good discussion over lunch with a lot of excellent research and very interesting insights. That it was a very good start. So it's a pleasure to be here with you. And as Tony said, I've been in Brazil a few times. I've had the difficulties of finding the sidewalk and and the bus line, and etc. before. And what I thought we would do, we've been working in low carbon development in WHO. So I think it fits very well with your ideas of resilient futures for a city which is looking at climate change issues and how to respond to that. What I'll start is by painting out some of the challenges that what we see we're facing today. Is not only you, all of us are. And coming up with some examples, and I think I'll hone in a bit on transport because we felt that was a useful idea. I had a few 15 years or so of work on transport and health and environment in Europe, so Tony thought it would be nice to get a bit of that history out, some of the lessons there, and then talk about what we're doing today in terms of looking at green economy and what are health co-benefits, and also looking at Rio Plus 20 Sustainable Development Goals, the next Sustainable Development Agenda, how we were using that connection in that context. So the challenges you know well, I presume. The first one is non-communicable disease, which is costing the world a fortune. Its estimates are sort of at the order of trillions of dollars. 2/3 of the people of the world die of non-communicable diseases, including in sub-Saharan Africa is half of the population today. So it's not like a developed country issue. Is major from the point of view of the health costs and costs for people. The second challenge, which we're also very familiar with, is climate change, which is a very, very big health challenge for now and for the future. And there's a number of connections which I won't, I take it that the audience would know well in terms of water and food access and infectious diseases, but also extreme weather events. And so it is, for the moment, the problem that we see it from the health perspective is that there's no connection with the climate negotiations. In the adaptation planning, there's very little health. I mean, there's lots of health in the discourse about how important climate change it is for health impacts and how we should be taking action, etc. But when it comes to the actual decisions, there is a bit of a gap. In terms of the funding that goes from climate to health, or in terms of acknowledging co-benefits, there's a big gap. And I think some of the work that we're doing on health and low carbon development could help bridge that gap and make the most out of those two agendas. In the health sector, on the other hand, we've been very concerned about the social determinants of health. And to which I have to say that environmental issues are completely socially constructed. They're economic and social. And we haven't yet, and I don't know how many people are from the health sector here, but really found the connection with the environmental health issues in the social determinants agenda. And I think that's one of the things that the connection with low carbon and development, economic development there is one that we can build. And it's just so far in the health sector again, we have been investing very little in prevention. And this is our OECD countries' estimates. It's less than 3% of the monies to health that go into prevention. And although we acknowledge the importance of prevention and primary prevention, we don't seem to have found a way of making that connection. Now, we do see that green growth, low carbon economy, the green economy agenda are a very large opportunity. It's been the response to economic crisis in a number of countries, but it is, I would say, the mainstream discourse in the OECD, in UNEP, in some of the economic commissions. So I think it's very important that we take notice of that. And we can relate to this. And this is just a summary of what it is about green growth. It's all technologies. How is it that we have skills and jobs to develop those new technologies? How can we eliminate barriers to trade and finance, create finance mechanisms? So the economic, in the mainstream economic discourse, where we see then that there's a good connection with public health and environment. So I'll start in how is it that we move into that direction. I'll start with a little vision. This is from the UK, it's Vision 2030. It is a vision for transport, for sustainable transport in cities. And that's the beginning or the end of my story about transport and health and environment in Europe, because that vision is being created, that is a couple of years ago. This is Woodcock, who some of you have worked with, who has been working on those. But it wasn't, the vision was not like that a few years ago. And I'll start that little story about transportation, health, and environment like that. This is mid-1990s, and the way we were dealing in the health sector with the health impacts of transport was like that. It was completely disconnected. Some people dealt with injuries, others with noise, others with physical activity and air pollution, and nobody talked to each other. Exciting stuff. So we also, so we started reflecting around that and just put together a few of the numbers. You know, what's the burden of disease that would come from transportation? And then you have, you know, lots of physical inactivity. This is all the numbers now. I mean, there's a very recent burden of disease which updated, and they're a bit larger. But just to give you a flavor, that's the way we started, putting together everything which was coming, all the risks which were coming from, risks to health coming from transport, and putting them in one package. The second step was to think of how transportation people, what transportation people's concerns are. It is mostly around congestion. And you know, how is it people cannot get from A to B and how long do they take? And what environmental people's concerns were, which were a lot about pollution. And the health people's concerns, which then injuries perhaps was the largest one, also air pollution. And they were not necessarily the same. So part of the initial work was to try to reflect on where were the connections. And part of the inspiration, I should say, were some NGOs. There was a guy called John Whiteleg in the UK. I don't know if he's around yet, but I think he is. I've seen some emails recently. Who I think made, some people make very important contributions to this debate. There's a guy from Australia called Jeff Kenworthy, which I've never met, but you know, was used a lot the evidence. He put together a lot of the evidence on modal split. And those pieces, those individuals, and those pieces of thinking are very influential in determining, I think, where, so I never met Jeff, but I use a lot of his work. I met John Whiteleg once or twice, and that was very formative to our own work in WHO. And I had a lot of resistance from my colleagues working in air pollution or injuries. Nobody liked the idea that we were going to pack everything together in one package. And who's going to have the power of that one? You know, that kind of stuff, which is all human and normal, you would say. So the third point that we've honed in, apart from, you know, where the burden and where the interest from transport, health, and environment, we started looking at what solutions were being proposed by different people. And we saw a lot of this. People see one solution, one technical fix. Well, that's gotta do the job. And this is just an example of air quality in Europe, where although there's been lots of technological improvement, much better fuels, much better engines, the net result of air quality today, this is again an older slide, is that there hasn't been much improvement in air quality in Europe over 10 years, in spite of the technological improvements. Just because the size of each engine increased, and there's also more diesel vehicles. So there was a bit of a mistake, you know, they didn't realize that diesel was producing much more particles than other things. But so I think there's some lessons there, and at that point we saw that those technological solutions necessarily wouldn't do all the job. And we saw also that there was a complete aversion at that point, this was mid-1990s, to talk about cycling. This was something for freaks, you know, if you're really alternative, it's really out there, and nobody in the air pollution world would like to see that, neither on transportation and health. You know, it was all about physical activity as a sport. So there was, I think, of all the risks to health from transport, perhaps that's the one which I felt there was greater difficulty in engaging with in terms of the mainstream, as a mainstream issue. And so that's the one where we put some more of the emphasis in the follow-up. Now, the last point that we came around of putting that evidence together And then we thought of what is the justification for governments to take action? Because we've got to give advice to governments. That's our job. Our bosses are the ministers of health who come to us once a year. So we thought we should articulate that logic. And one of the reasons for governments to engage was that there's this very polarized debate with the car and the perhaps energy lobby pointing the individual benefits for self-mobility or deciding where you want to go, whatever time you want to go in your own car, override other costs, and the health and environment lobby thinking that really this is about safeguarding the environment, the economic vitality of citizens. It's a very disparate and polarized debate. So we thought it was a good reasons to provide advice to governments on that. And there was a number of other reasons. One of them is that to do sound economic decisions. This is a completely utilitarian argument, which, and the reasons for us to provide advice on that is that the market fails to deliver social optimal patterns or solutions for society. We have external costs of transport which are not paid by the user, and this ends up affecting people, and because people get ill, they don't go to work, absenteeism, they may fall out of money because of disease costs. So there has impact in society that they're not taken account of by the people who are using the transportation systems which are creating these externalities. Also, there was no evidence that the good science was being used in transportation policy decisions. There's lots of myths about how easy cycling was something freakish, and it was difficult to get hold of the information, of the good sound information on the evidence about the costs and benefits. So the end result is that the science was not being translated into policy. And so there was a need for some trusted body to provide that kind of information. And then there's the vulnerable groups, people who like children or like the disabled, who children don't vote. They don't have a voice in society normally, with the exception of Sweden, perhaps, that they have ways of listening to children on public policy issues, but I think that's the exception rather than the rule. And somebody has to speak for them and to defend their interests. And last but not least, there's an issue of health equity, where poor people live busy roads, breathe more air pollutants, suffer more of the risks of traffic accidents. And if we want to address health equity, we have to be addressing those issues. So the end result of all that reasoning was a series of meetings, discussions, documents, and we created a governance mechanism in Europe, a group of people interested in these issues. And some were from ministries of transport, this is intergovernmental. Some were from Ministry of Environment and some from Health. And so this group first decided whether there should be some kind of convention, because we have United Nations Economic Commission for Europe, they like conventions. So we decided that conventions perhaps wasn't the way people would go, and they set up for a program of work that involves some more evidence about costs and benefits, for example, some tools for people who are doing transportation planning to engage with these health and environment issues, and some ways of monitoring what's happening. So I'll go very quickly of some of the tools that we developed. This is some modeling, and we engage very deeply, but there's research monies in Europe that can be used for this, engaging different people. So we went very heavily on models and integrated models to assess health risks. This is one for physical activity, for injuries and mobility in urban areas. This is science, systematic reviews for cycling. Lots of work on the cycling part to show that there's benefits, and this shows there's 30% mortality reductions in cities that engage with cycling on a regular basis. So initially it was Copenhagen and Shanghai, but there's a number of other cities that, this is the systematic review, that shows only 30% is an enormous benefit, with huge economic benefits as well. There's a discussion about cycling. Does breathing air pollutants and risks of injuries increase the risk much more than the benefits from heart disease? So there's a number of studies which show that there's much larger benefit from heart disease reductions in diabetes and obesity than the risk from breathing pollutants and traffic injuries. So there's a number of studies. Again, this is another piece of work that compares the risks and benefits. We did some tools, easy to use, HIT for walking, HIT for cycling, based on that evidence that does cost-benefit analysis of interventions in the built environment to support cycling or walking. So there are two separate tools. We had some case studies, good examples, some benchmarking. This was not us, this was some NGO, showing what policies for cycling and walking were being done in different cities in Europe. So the benchmarking is something that makes people move around, and people like to learn about other cities. And this is something that perhaps Canberra should think about in the way that you're developing yourself as a low-carbon city. Perhaps you could be creating the basis for some of these comparisons with other cities in Australia and elsewhere. This is just an example. People in Brussels don't cycle, but people in nearby cities like in Delft and in Gand cycle much more and use much less private car, use more trains. And in some cases, we're happy to see that some of the results of the risk assessment we've done, like in Florence, there was a question. The car association took the municipality to justice, to the courts, because the municipality had done the plan is described there. It's a plan for sustainable transport in the city with more rapid transit, with more space for pedestrians and cyclists. There's a whole package. And they said you're curbing the liberty of the individual car user to, express their, I don't know what, macho behavior, I have a big car, etc. Italy, la mia macchina, no? And what the courts was interesting because we had done a study of documenting the health risks and benefits from their strategy versus not having the strategy. Now that was the counterfeit. And using air pollution and noise, and come up with some benefits. And the court has used that. I mean, we didn't propose that to the court, but they found out, and somebody took it to somebody in the community, and they voted positively to the measures of the community on the basis of that study, which is quite interesting. Here's just we use GIS. Our models had a lot of GIS overlays in terms of the way that we assess risks. And so this is the noise one, the previous was air pollution. So the end result of this story is that Lady Thatcher, in the mid-1990s, when I started doing this work, that's what she was saying. She was saying, a man who at age 26 finds himself in a bus can consider himself a failure. Now, she wouldn't dare, she's not there anymore, but she wouldn't dare to say this any longer. And in 2002, there was a European Union Parliament decision that's described there that specifically asked for the integration of health considerations into any transport plans in Europe. Now that has been, what I see is a very, this is less than 10 years that this happened. From moving, especially from this sort of horror when you're talking about the integration, about cycling as a transportation mean, into something which is now considered mainstream. And any city in Europe which is considered more or less affluent has to have bicycles, has to have pedestrian space, and has to have either a shiny tram or some rapid bus transit system, either on rail or on bus. So I think that's today considered the thing to have, and it wasn't the norm when we started this in 1995. So I'll very briefly say that experience has led us in WHO. Of course, we were working with all sorts of other people. It's not only WHO. And that's why it happened. I mean, there wouldn't be any point if it was only WHO. So it was across sectors. It led us to work more on other sectors of the economy in low carbon development, on the green growth analysis. In what we've done in the green economy analysis, considering that this has become such a prominent debate and discourse, was to take, again, an analytical and just put the science together, asking, is it what being proposed as green economy today good for health? What specific policies are being put on the table? What do they do for us, as human beings, as individuals? So we could play our role and contribute to that debate. It's not to say that health was going to be make the final decision about what's valuable or not. But we felt that there was a valuable consideration. And if you look at externalities as considered, calculated by environmental economists, most of the costs from externalities come from human health impacts anyway. So the fact that those discourses don't include health, I think there's a bit of a, we have a job to do that. So what we've done is, this was in 2010 when we started, we felt that smart development policies should improve health. They not always do that, so we should be there to say when is it the case. And we did a few, we took the IPCC because OECD had not yet in 2010 made any specific commitments about what policies were good or not. Now they have. But at that point, they were not there. And the only set of policies that we found which were low carbon were IPCC mitigation strategies. So we picked them up and unpacked them and put health evidence around them. We did one, IPCC hasn't spoken about health systems and health services, but we thought as health services are 8 to 10% of any economy and produce a lot of greenhouse gases, and we work for the health sector, we should be doing something there. So we created a package building on buildings, transport, water use. So we developed a package for health system, which led to some very interesting evidence, and I won't bore you with the detail of that because there's far too much detail. So we did detailed analysis of evidence, putting together the case for green hospitals in a nutshell. From ventilation to access to transport, and these are the elements of a green hospital. That's the result of those analyses, and that's what we're working today. And I heard you're going to be doing a hospital at this university, and I suggest that you take note of some of those criteria. I think it's good. If you're doing that today, you could be a good example. Second was on transportation, and you heard, we've talked a lot about transportation today, but what we noticed is that the IPCC was proposing diesel as a strategy to reduce CO2, which is really important oversight, because you shouldn't be proposing something that produces such nasty health disbenefits, produces cancer, it produces heart disease and lung disease in a major way. So there are other strategies. In fact, they were not paying so much attention to land use and sustainable transport means, like a mix of cycling and walking, public transport. That should be done. And what we've done, and I think it's nice to see that we pick up what was being proposed and what we were saying that should be done, like infrastructure for walking, infrastructure for cycling, public transport like rapid transit systems. And we look at what evidence there was that there was health benefits. And we just listed the papers which had demonstrated health benefits. And we listed the papers that have demonstrated not health benefits or no benefit. And in fact, the evidence comes and it's useful just from the visual point of view to see that there are so many studies which show that using buses or rapid transit systems can improve obesity and heart disease, which for me was a surprise. I wasn't expecting that had been studied and documented. So that is the process. We also did the same thing for housing. We picked up what the IPCC has said about what proposals they were making to improve the CO2 from housing. This is the lowest hanging fruit in the IPCC terms, housing is. Looked at what the risks to health, disease risks, health equity issues, and created a series of analyses, and I won't again go over them. Some to do with air conditioning, which is seen as something that many people are not. They are seeing still as a way of adapting to climate change, which of course could be, but you're also being more vulnerable, because if you don't have natural ventilation or other mechanisms of keeping buildings cool, you're creating is like a double-edged sword. Or green areas, perhaps, that could be greater focus could have been put, or insulation that was given irrespective of ventilation associated issues, and you have issues of mold and indoor air pollutants, chemicals, etc. So we created a package for housing, and overall there was this issue that the range of land use, transport, and housing issues were not being considered. We used the same kind of analysis or the same kind of evidence for the gap that existed for the Rio Plus 20 meeting last year, when Sustainable Development Goal forgot to put health in. The basic document in Rio Plus 20 did not include health, in spite of many people having contributed with it. So for us, it was a great surprise, because we have contributed. Certainly, we come January, the first document, draft document, comes in, and there's no health in the new vision for sustainable development of the world of the UN. So we got along with our friends, such as yourselves, and created various working groups, etc., and took whatever they have in their discourse, which were those are the themes for real: energy, water, food, cities, jobs, and created some health indicators for that. Using the same kind of evidence. And the red document summarizes those health indicators. And we've been using that ever since, and engaging in some of these groups in the post-development goal. So this is some of the examples of indicators, like things that we have. We have information for air pollution. We know from the WHO guidelines what's safe air pollution. So we can say the proportion of population in cities is exposed to those levels. So it's not. It could be a no-brainer for us who know those issues, but not necessarily connected to the development goals debate. So I'll complete my beginning of the conversation, hopefully. And these are my conclusions. From that experience on transport, on the green economy, on our connections with the sustainable development debate, in using information to connect from health and research results, I think what we have to see and what we have to offer, which is different from the early days of the climate debate, which was very much about how horrible it's all going to be. And of course it is going to be pretty horrible. But I think there's another part of the story, which is how good it is and how many opportunities you have for public health that you're creating by having this low carbon development. And our sense is that part of the conversation has not happened as much as it should have happened, or as it could. And I think we have a very special role in people like, and I was really excited with the research that I heard today, and the kinds of connections which were being brought, which are not yet part of the conversation. So, and I like this issue of the conversation that you're having here in Australia, because I think that's what we need. And I'd say that the way forward for climate change, for public health, for the reduction of non-communicable diseases and more prevention, and also for the green growth debate, is to make that connection much stronger. So I think we have to find ways of strengthening those knots and talking about them and having them very clear in the minds of other people. It is a long way. The minds of economists are different from the minds of public health physicians and of people who are in all these different sectors. And that's just natural. We're just coming from different points of view. But making that conversation possible, I think health has a connection element that can be done. And I would say that the first point is having the research results. And I say that on the basis of what we've been doing in WHO and where we've been sitting. I mean, to have the right question asked by a researcher is essential for us to be able to talk to this. So formulating the questions. We have 100,000, maybe I'm exaggerating, maybe it's 10,000 studies of how much does air quality impacts on health. Now, we know bloody well that it impacts very badly, and that question has been asked again and again and again, and of course it's important it has been asked. But we only have 10 studies which looked at the impacts of interventions to reduce air pollution on public health, on the benefits. So I think asking the right question is the first thing. And I think researchers are about, and universities are about asking questions. And research bodies, grant-giving bodies, are there to fund those kinds of questions. So I think that articulation is very important, first. In the climate change, in terms of the tools that we have in the health sector that we can use, I think health impact assessment is quite crucial. And this is the general frame that we have to look at those policies in other sectors and have a way of approaching them. Also, economic valuation, I think we should be using more. Economists tend to use it. I think we have good quality data that we could put to that because it facilitates the conversation in economic terms. And on climate mechanisms specifically, I think we have to, climate finance doesn't connect to health. It should. And I think we should be making those points. CDM should be considering, clean development mechanisms should be considering health benefits, not only CO2 reductions. And the MRV, the monitoring, reporting, and verification, should be monitoring, reporting, and verifying that there are health benefits. That package of actions, sort of bringing that health into evidence should, I think, make that conversation easier. And I hope it's a long start for a conversation between us, but I hope it helps start the conversation. Thank you. Cool.